It's often said the eyes are the windows to one's soul, but our guest today says that the eyes are also a barometer of our overall health and nutrition. Dr. Shailesh Kaushal is a world-renowned expert in retina diseases. He has a local practice here serving North Central Florida, Comprehensive Retina Consultants. We want to thank you so much for being with us today. We are talking today primarily about macular degeneration. Can you tell us a little bit about this disease?
Sure. So the retina is the photographic film of the eye, no thicker than tissue paper, attached to the inner wall of the back of the eye. And the central area of the retina is called the macula. That's for our high central acuity and for color vision. In macular degeneration, it's an inflammatory disease which is nutritionally controlled. It affects that area of central good vision. Patients can have multiple symptoms. They can have blurring of vision, distortion of vision, or areas of their vision where it's whited, blacked, or grayed out.
And who is most affected by this? What age?
Yes, so as the name suggests, it's usually in people over the age of 65 that we start seeing as retina specialists or ophthalmologists the manifestations of the disease. But the disease itself predates that, starting often 1 to 2 decades before.
Wow, that's quite a bit. So would you have had symptoms at that point, or how will you find it?
That's a wonderful question. It's usually asymptomatic in those very, very early stages. However, ophthalmologists or retina specialists can sometimes detect those early changes. That's why it's important to see an ophthalmologist and retina specialist at least once a year.
If you find it earlier, we're going to talk about some of the treatments in our next segment, but
Sure.
If you find it earlier, do you have a better chance of getting it under control?
Yes, just like any disease. In the early stages of macular degeneration, there are published papers to show that it's reversible. So parts of that disease can resolve, and that's been enigmatic and also intriguing to all of us, because it also the possibility of new treatments can be based on catching the disease early.
Are a lot of people affected by this?
Yes, it's extremely common. It's rising throughout the world. We used to think it was a disease of the Western world, but the developing world as well. The incidence of macular degeneration is essentially identical as it here is in the U.S. and in the developed world.
Well, I don't want to give it away, but I would hint that maybe perhaps what we're going to talk about in our next segment about nutrition might be part of the reason our diets could have a factor.
Yes, there's compelling data, and the data keeps coming out and published in peer-reviewed journals, identifying that macular degeneration, like many chronic disorders like Alzheimer's disease, hypertension, atherosclerotic disease, are nutritionally controlled.
So what early symptoms should we be looking for?
Yes, like we talked about, the key is to have a yearly eye exam. But at home, what you can do is check the tiles in your bathroom or kitchen, make sure they're straight and they're not crooked. And if your vision gets blurry, especially if you're in that age group of 65 or over, is to make sure you're getting evaluated. But that's a simple thing to do, is check the tiles in your bathroom or kitchen.
Well, we will be back with the doctor in our second half hour to talk about these new findings, so we look forward to hearing more about that from Danielle. We are welcoming back Dr. Shailesh Kaushal, a retina specialist, to talk more about what we can do to save our eyes. Let's jump right into some of those treatments, the newer treatments for macular degeneration.
Sure. So macular degeneration, there's two basic forms. There's the dry form, where there's inflammatory debris deposits underneath the retina, and the wet form, where there's leaky blood vessels that can leak either fluid or blood. So for the wet form, we've had treatments in the past, but there are newer treatments as well, which can allow patients to have less frequent injections. Eylea high dose, Vabysmo are two examples of that. For the dry form, it's been a very exciting time for us. There are two drugs for a specific form of dry form called geographic atrophy, and that's Syfovre and Izervay. And those medicines are the tip of the iceberg for new treatments, new pharmaceutical treatments for macular degeneration.
Well, that's exciting. Hopefully, if someone has it, they can get the new treatment. But one thing that you've been mentioning that gets to the root cause, I think is very important, is nutrition.
Yes. So it's often overlooked by us as physicians, in part because we don't get trained so well on nutritional aspects of human chronic diseases, which is actually very well established. Macular degeneration, as I describe it to my own patients, is a chronic, inflammatory, nutritionally controlled disease. Now we know that the same inflammatory markers that are associated with high blood pressure and coronary artery disease and Alzheimer's disease are also correlated with macular degeneration, glaucoma, and diabetic retinopathy. So in that instance, we discuss with patients. I make sure we give every patient a handout, but I hit some of the highlights of what is in the published peer-reviewed literature. And those include simple things that we all can do starting this afternoon. A good multivitamin with the B complex. There's 40 to 41 essential vitamins and minerals we all require for our metabolism, and we want to optimize our metabolism. 80% of Americans are deficient in a set of those vitamins and minerals, and that's clearly associated with chronic diseases. Second, omega-3 fatty acids. We've all heard about fish oil, krill oil, or even better than that is cod liver oil, what we used to get when we were young. And it used to stink in part because of the way it was isolated. But now there are better ways to isolate cod liver oil. And a lemon-flavored cod liver oil, 1 tablespoon a day, is excellent for all of us.
So just really practicing good health is good for your eyes as well.
Absolutely.
And this could be preventative? Could it reverse it?
So that's a great question. In fact, we run a yearly meeting, we haven't done it since COVID, called The Reversal of Chronic Diseases. And we bring experts from throughout the country at the leading medical schools and research institutes to talk about reversing diseases, not just in the eye, but elsewhere in the body. So there are, as I mentioned previously, there are published papers in the macular degeneration literature showing reversal and actual resolution of the disease itself.
That's promising, very promising. So much we could say about this. We thank you for joining us. And if you do want to know more about this topic, we have more information and we have links on our website at wcjb.com. Thank you.
Thank you.